There we go. Sorry, it was me. Technical difficulties, but it was self-inflicted. Anyways, thank you so much for your time and thanks for being here today. You are a pediatrician over at Children's Primary Care Medical Group in Carmel Valley, originally from Chicago. You have two daughters and a husband here, and you guys love spending some time outside, which I'm sure it's a little bit easier here than out in Chicago.
Definitely.
Yay! Well, we are so excited to have you here today, and I won't talk anymore because I think everybody's here to definitely hear from you. And you're going to be sharing about the first 2 weeks and kind of what to expect when you bring your baby home. So I will hand it over to you and kind of remove myself and everybody give her a good welcome.
Thank you so much. So as Nikki mentioned, I'm one of the pediatricians here at Children's Primary Care Medical Group, and I'll be sharing a little bit on kind of the first 2 weeks of life. So let me share my screen here. All right, can you all hear me and see me? I hope you can. So first 2 weeks of life, the main things we hope to kind of review in this presentation is just what to expect when you're in the hospital right after delivery. The 3 or 4 things that your baby will do, which is eat, sleep, pee, and poop. And do a quick review of some normal newborn findings, which you may appreciate when you get home. We'll end with a little bit about what things that you would want to contact your pediatrician with. So you're at the hospital and congratulations, you've delivered. Hopefully it's a boy, girl, or everything in between. At the hospital, the main purpose is basically preventative care. So one of the first things that you'll notice will happen to your newborn baby is that they'll be given a vitamin K shot. And this is something that they get to prevent something called hemorrhagic disease of the newborn. Babies don't have adequate amounts of vitamin K, which help in clotting. So after all the rigors of delivery, we don't want any sort of bleeding problems. So the first thing that they'll get is a shot in the thigh of vitamin K. And you'll notice that your OB will also put some ointment in their eyes, and that ointment will be an antibiotic that prevents the eyes from infection. A long time ago, eye infections from vaginal deliveries used to cause blindness in children. And ever since we started applying them immediately after birth, we don't have any problems like that anymore. The next thing that you may notice the hospital provides you is offering you the hepatitis B vaccine. Not a lot of people know what hepatitis B is, but it is an infection of the liver. And a normal liver looks something like this. It's smooth and beautifully clean. But a liver that could be infected with a virus called hepatitis B can look something like this. And you would go from chronic hepatitis, which is all the way over to the left, and progress on to something called cirrhosis, and it can even cause cancer, so hepatocellular carcinoma. Hepatitis B is very dangerous. It can be life-threatening, so we want to eradicate it. And thankfully, the reason why most of you may never have heard about it is because we have such good vaccination early on in the hospital. If you look at this map from the CDC, you can see that the majority of the world has moderate to high levels of hepatitis B infection. When you get hepatitis B as a newborn, it actually is chronic and lifelong, and it's very difficult to treat. So outside of the United States, Canada, and Mexico, and parts of Southern America, it's fairly rampant throughout the world. So we do like to get our babies vaccinated with hepatitis B early on to keep our country safe. The other screening tests that you'll notice in the hospital are a hearing screen. And this just makes sure that your baby is able to hear you. They'll check a jaundice level, which is typically over the skin, making sure that your baby is not too yellow, which can be harmful to their brain. They'll check oxygen levels of smaller babies in their car seat so that when you're taking your baby home, there's no risk for poor oxygenation. And they'll do a little heel poke. And these little circles on the bottom of the screen are blood samples that are sent for all babies born in hospitals to check for a few blood diseases. So California newborn screens, it's kind of changed over the last 40 years or so, but originally it was meant to diagnose kind of diseases that can suddenly harm babies in the first few weeks of life. Over time, we've added a few more diseases to that plate, and now we have 50 or so diseases that we can diagnose just from a heel blood sample, and all of these are usually reviewed with you at the first or second month well visit to make sure there's nothing concerning going on with your baby. So you've done all those things. Hearing is normal, jaundice is normal. We have no problems with oxygenation. The newborn screen is sent, so you're homeward bound. And that alone, a lot of work. So we're pretty excited about that. But you know, at home, it can be fairly exhausting. So your baby does only a few things at the first 2 weeks of life. They eat, sleep, poop, and then they do it all over again. And after a certain amount of time, it can really feel like Groundhog's Day. Sometimes it can even feel like those next 14 days are just lasting forever. So here's a few things that I want you to remember. Feedings. We feed every hour, every 2 hours, every 3 hours. It kind of depends on your baby. But there's a couple ways you feed. You can breastfeed, you can bottle feed. My colleague, Dr. Nodden, will talk a little bit more about breastfeeding. But in general, just keep in mind that whatever you do, baby that is fed is best. Weight checks are pretty important, and we'll see you for a few visits in the first couple weeks of life. But by 2 weeks, we basically want to know that, hey, you're not down more than 10% of your birth weight. And in general, we want you to gain somewhere from half an ounce to an ounce per day. By 2 weeks of life, we want you to be back at your birth weight. So that's the general thing about feedings and weight checks. Sleeping. In the first, you will not sleep well. And everybody who tells you to sleep when your baby sleeps, this is the cartoon that I have for them. It's very hard to sleep when your baby sleeps. So just get a lot of sleep right now and make sure that you guys take turns watching the baby. Safe sleep is the main important part that I want to emphasize. And when you look on social media, you'll look on Instagram and they'll have all these beautiful cribs with chandeliers and blankets and pillows and bumpers and these stuffed animals, and basically want to reiterate that this is not safe. Hopefully you can also find these beautiful, clean, safe spaces, equally Instagrammable, I hope. But I just want to emphasize on your back with nothing else in the crib, no blankets, no pillows. So no and yes for these, to make sure that your baby is the safest when he's sleeping. The reason we care about safe sleep is something called sudden infant death syndrome. We call that SIDS. And this is a very busy slide, so I just want you to appreciate two things. The bar shows the rate of sudden infant death over time. From 1988 to 2006, which is where this is tracking, you can see that there's a decreased incidence of sudden infant death syndrome. That decrease kind of starts around when the American Academy of Pediatrics started this Back to Sleep campaign, or the Safe Sleeping campaign. And as you can see, the longer we've been promoting sleeping on your back, the lower the rate of sudden infant death in children. So let's move on to wet diapers. How many wet diapers should I have in the first 2 weeks of life? So if you look at this graph, you'll see on day 1, we want 1 wet diaper. On day 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. And after 6 days of life, we want 6 plus wet diapers. So it should be fairly easy to remember, how many wet diapers should I expect? And that is how you track, is my baby feeding appropriately? Are they dehydrated? Are they getting enough milk? So 1 wet diaper for every day of life, up to a week. We don't want it to go much longer than that. Otherwise, you and I would be peeing quite a bit. Bowel movements. There's some changes in the bowel movements in the first few days of life. So very first poop will look something like this. It's very thick and black and tarry, and we call that meconium. It then progresses to transitional stools, so it looks a little bit like greenish. And then it finally becomes this beautiful yellow seedy stool. Some people liken it to mustard or Dijon mustard. It has those little seeds. So let's quickly review some normal newborn rashes, because the things that parents appreciate more is how their children's skin looks. And there's a lot of changes over the first 2 weeks that you should appreciate. The very first thing that you'll appreciate is your baby comes out and there's all this stuff on their head. So these 2 pictures, they look very similar, but one is Fernix and one is cottage cheese. They look kind of similar to each other. The other thing that you may notice is right over the eyes and right over the center of their forehead, you'll see kind of this red rash, and we call these angel kisses. And it's kind of a nice cutesy name because it's nice and cutesy, it's not dangerous. And on the back of the nape of the neck, you'll see something called a stork bite. And we show that here with a stork because that's how your baby was delivered to you. So these are all normal. This looks like a very concerning rash, almost looks like pimples. These happen somewhere after you leave the hospital and then subside at about 2 weeks. But we call this rash erythema toxicum. We call that ET for short. And this is also a very normal newborn rash, usually subsides by about 2 weeks of life. Finally, at about a week of life, you'll also appreciate that your baby's skin is peeling. And that's not because your house is dry or there's any concerns, but this is just normal newborn peeling. You want that skin to peel off, and then underneath you'll have new beautiful baby skin. So no need to worry about skin peeling. And then progressing on, this is a common skin finding. We call this cradle cap, but some people call it cradle crap. Because it's pretty annoying. There's this thick yellow scale over the forehead, over the eyebrows, over the scalp. But thankfully can be treated pretty easily. We throw a little bit of Selsun Blue on there, some antifungal shampoo, and it'll get rid of that pretty quickly. Most kids outgrow it at about 6 to 8 weeks. And then the most notable finding is that towards a month of life, you may start appreciating some neonatal acne. And all of these do resolve over time. So nothing too much to worry about, even though visually they can be quite alarming. So when to call your pediatrician? We always are worried if your baby has a fever. Fever is 100.4 Fahrenheit or higher. We recommend those temperatures to always be rectal because they are the most reliable. If your baby is not feeding, not having the appropriate number of wet diapers per day of life, or they're not gaining good weight, we want you to call. If they have worsening jaundice, say you left the hospital, but now they look more and more yellow, we want you to call. And if you have any funny colored stools, it's not black after any sort of black stools, white stools, gray stools, red stools, things that are not in our color palette of stools we care about. And then if someone tries to Instagram your crib, care about that too. So don't do that. And the whole thing is a marathon. It's not a sprint. So it's not about trying to do everything you can possibly do in the first 2 weeks, because this is marathon for a long time. And if you don't remember how to do a marathon, just remember right foot, left foot, take it a day at a time. Here's a little bit of information about us. And if you'd like to call us for any of your pediatric needs, you can reach us at this number.
Wow, thank you so much. That was amazing. If anybody has any questions, feel free to drop it in the comments. Can you hear me okay? Yeah. Do you hear me? Yeah. I have just kind of a random question, because I saw that you said you could treat kind of self-and blue. Are there any products, like when you're trying to maybe self-soothe or like correct something at home with a rash or something like that, to stay away from? Is there anything that throws up a big red flag?
Yeah, we would always prefer that you call us first.
Yeah, first. I was just curious when you.
So we always want you to call us first, but in the first month of life, we actually don't recommend any products on the baby's skin. The baby's skin is very sensitive, and we don't know which babies will be more sensitive than others. So the most we want is butt cream in the diaper area, maybe some Vaseline, but that's about it. Anything else, please touch base with your pediatrician, and be happy to direct you to some safe over-the-counter options.
Nice. And then I know, obviously, the focus is on the baby, keep the baby alive. First 2 weeks are very important.
Yes.
There's a lot of stuff going on. Is there any advice that you have for moms? I mean, it's a very difficult time, and I think the emotional, and we do have a question here, but is there any emotional advice that you can give to the mom? Obviously, I think I had to laugh when you said sleep with the baby sleeping. That's definitely a false, whoever says that needs to stop saying that. But any other advice you can give for self-care or just checking in? And
yeah, so I was a pediatrician for 4 or 5 years before I had children, and I could scream at myself for the things that I had said to parents before I became a parent myself. You really need to be nice to yourself. Even as a pediatrician, I felt like I didn't know what I was doing. So I have so much, I really feel for everybody as a first-time mom. It's so hard. You really just need to be gracious and be kind to yourself, because it's a hard time for anybody and everyone.
There really is. And it looks like we do have one question here. My baby currently has thrush, and I've treated with my statin, but it doesn't seem to be going away. Any tips?
Yeah, so thrush is really hard, because if you're breastfeeding or if you're bottle feeding, it transfers. It's a fungal infection that can transfer from the baby's mouth to anything else that the baby's mouth touches. So sometimes it can be very resilient, because the breast can have thrush and you guys just keep passing it back and forth to each other, or the bottle nipples aren't being completely sterilized and the thrush is kind of staying on the nipples. So I would recommend get some over-the-counter Lotrimin or antifungal cream, put a little bit on your nipples if you're breastfeeding. Otherwise, do kind of a hot boil of all of the nipples or all the pacifiers that your baby uses, and that can help just kind of eradicate it a little more quickly.
This might be a dumb question. I've 5 years from breastfeeding, 5 years ago. But can you put that cream on and then is there a time you have to wait before you can breastfeed, or?
Yeah, that's a great question. There's something called Newman's nipple ointment. It's